Welcome to the debate. Today, we're diving into what's become a really pressing public health challenge, vaccine hesitancy and the broader anti-vaccine movement. It's certainly a complex issue. It pits the undeniable benefits of widespread vaccination against some deeply held individual beliefs and, frankly, historical distrust.
Right.
So the central question we'll explore is this. How should society navigate this tension between, on the one hand, public health imperatives, and on the other, individual vaccine choice, especially in an era shaped by, past grievances and just pervasive misinformation? Now, this discussion comes out of a rich body of source material. It highlights both the scientific consensus on vaccine safety and effectiveness and the profound historical, psychological, and political factors that, fuel skepticism. So I'll be arguing that despite some historical medical errors, the robust scientific evidence and the clear societal benefits of vaccination really necessitate strong public health measures and a firm stance against the spread of misinformation.
It's from a slightly different angle. While, of course, acknowledging this scientific evidence, I believe that truly effective public health strategies have to start by understanding the complex roots of this distrust. We need to openly acknowledge past institutional failings and engage with individual concerns using empathy and transparency. Simply dismissing all hesitancy as just anti-science, I don't think that's going to get us where we need to be.
Okay, let's start with the hard science then. The overwhelming consensus among scientists confirms vaccines are incredibly safe and effective. Experts like Dr. Joe Pierre, professor of psychiatry, and Dr. Paul Offit, a pediatric infectious disease specialist, they've consistently stated that, look, no credible scientists believe vaccines are anywhere near as dangerous as the diseases they prevent. We have vast studies disproving these anti-vaccine conspiracies, like the false link between vaccines and autism. Yet, despite all this evidence, vaccine skepticism is actually growing in the U.S. The Annenberg Public Policy Center reported that the proportion of people believing vaccines are unsafe jumped from, 9% in April 2021 up to 16% in the fall of 2023.
That's a significant jump.
It is. And this isn't just abstract concern. It's leading to dangerous real-world consequences. Things like declines in vaccination coverage for kindergartners, dipping below those crucial herd immunity thresholds at point where enough people are vaccinated to protect the whole community. We're seeing alarming resurgences of measles, more Americans infected now than in decades, and tragically, a recent death in West Texas. Even polio, a disease we thought was, almost behind us, saw a case confirmed in Rockland County, New York for the first time in nearly a decade, and it was linked directly to an unvaccinated individual. Now, this crisis is definitely exacerbated by high-profile figures promoting vaccine skepticism, notably Robert Kennedy Jr., who, as the current Health and Human Services Secretary, has made some, frankly, deeply concerning moves. Just last July, Robert Kennedy Jr. falsely claimed, quote, "There's no vaccine that is safe and effective," unquote. And he continues to champion that debunked 1998 study linking the MMR vaccine to autism.
Still? Wow.
Yeah. As HHS Secretary, he even fired all 17 members of the CDC's Advisory Committee on Immunization Practices, the ACIP, replacing them with individuals who, share his anti-vaccine views. He unilaterally removed COVID-19 booster shots from recommended schedules for pregnant women and healthy children, and the FDA, under his oversight, restricted booster eligibility, making them harder to access and afford. I mean, these aren't just misinformed statements. These actions demonstrate a deliberate effort to weaken America's public health system. That's what former CDC Director Susan Monterez pointed out. And it's driven by individuals who directly profit from anti-vaccine rhetoric, including Robert Kennedy Jr. himself, who received over $500,000 for chairing the Children's Health Defense in 2021.
Okay, I certainly understand the gravity of those statistics and the impact of declining vaccination rates is undeniable. However, I think it's really crucial to understand that vaccine hesitancy isn't simply this monolithic anti-science stance. It's often rooted in, well, deep historical events and quite understandable psychological responses. Take the 1955 Cotter incident, for example. A polio vaccine batch wasn't fully inactivated. Tragically, it resulted in 164 children being permanently paralyzed and 10 deaths. I mean, this event profoundly shook public trust, and it actually gave birth to modern vaccine regulation as we know it.
Right, a key moment.
Exactly. And then decades later, you had the 1982 documentary Vaccine Roulette. It focused on the DPT vaccine and its rare but severe temporary side effects, but it further fueled fears. It led to claims of permanent damage and eventually prompted the creation of the National Childhood Vaccine Injury Act in 1986. Now, these weren't isolated incidents. Alongside a broader public distrust of government institutions, think about things like Watergate, they created an environment where skepticism towards medical authority could easily take root and, persist. Dr. Joe Peer, who you mentioned, notes that when people are deeply disillusioned or experience severe cognitive dissonance, that mental discomfort when beliefs clash, they often resolve it by, digging their heels in even deeper, rather than changing their minds. And Dr. Devin Grayson's research highlights something important too. Dismissive healthcare encounters often push individuals, particularly mothers, to seek answers in online communities. And those communities then reinforce their doubts. The anti-vaccine movement is quite effective at tapping into fundamental psychological needs like uniqueness, a sense of control, social affiliation. Robert Kennedy Jr., for example, has found a remarkably receptive audience among mothers who see themselves as, fierce protectors of their children. As Nikki Hill Johnson observed, he speaks with an authority that makes his claims feel like the truth to them. And look at this Harvard SSRS poll. It found that 80% of those opposing vaccine requirements cite parental choice as a major reason. Not safety concerns primarily, but parental choice. This highlights a really deep-seated tension between individual autonomy and state authority, reflecting America's founding libertarian values, where, as historian Atlantic Conis points out, the authority of the parent often clashes with that of the state.
I hear your emphasis on historical context and the psychological roots of distrust, and I agree, those are vital to understand. But what I find so compelling is how much our systems have evolved precisely because of those past failures. The robust regulatory and monitoring systems we have today, the FDA, CDC, the Vaccine Adverse Events Reporting System, VAERS, they truly represent, and this is Dr. Paul Offit's phrase, the most elaborate and detailed system of vaccine safety the world has ever seen. Science itself is fundamentally enormously self-correcting. Data guides our beliefs, and past errors like the Cutter incident didn't just cause distrust, they led directly to stronger regulations, better oversight. The resurgence of measles and that polio case in Rockland County, these are clear, devastating consequences of declining vaccination rates. They underscore the urgent need for trust in these established, self-correcting systems to protect community health. As Dr. William Schaffner emphasizes, the entire medical community consistently endorses vaccines precisely because of this rigorous scientific process and the robust safety mechanisms now in place. We learned from those historical errors, and we built better safeguards.
I agree that our current safety systems are more advanced, absolutely. And the scientific process can be self-correcting. But you see, that's precisely where the tension lies for many people. While science aims for truth, the historical record also shows these instances where scientific claims were flawed or even deliberately misleading, and it took time, sometimes a long time, for the truth to emerge. Take Andrew Wakefield's fraudulent 1998 Lancet paper linking MMR to autism. Even though it was thoroughly debunked and he was stripped of his medical license, it took, 8 years for the truth to fully come out?
A long time, yes.
Was done. Even today, despite overwhelming scientific studies disproving such claims, you have anecdotal experiences from parents who genuinely believe their children were vaccine injured. These stories resonate powerfully. Dr. Joe Peer suggests that personal stories can often be far more persuasive than just bare facts alone when you're trying to address vaccine skepticism. And what happens when parents voice these concerns in healthcare settings and feel, brushed off by doctors? That dismissive interaction, as Dr. Grayson found, often triggers increased skepticism, pushing them to seek answers in, less credible online spaces. So it's not simply about the presence of data, it's about how that data is communicated, and crucially, how individual concerns, however scientifically unfounded they might seem, are acknowledged and addressed with genuine empathy, not just dismissal.
I find that line of reasoning deeply concerning, though, because it risks blurring the lines between, let's say, legitimate scientific inquiry and what is often a deliberate, financially driven campaign of misinformation. This isn't just skepticism in many cases. The anti-vaccine movement is increasingly characterized by, well, anti-science and disinformation, and it's often highly profitable. The Center for Countering Digital Hate found that an astonishing 70% of COVID-19 anti-vaccine disinformation was generated by just 12 individuals, including Robert Kennedy Jr., with their collective annual revenues estimated around $36 million.
$36 million. Wow.
Yeah, Robert Kennedy Jr.'s organization, Children's Health Defense, for which, again, he personally received over $500,000 in salary in 2021, actively promotes false claims, like his repeated assertions linking the MMR vaccine to autism, claims that have been overwhelmingly refuted by science, and I should add, even condemned by his own family. His influence, even while holding a government position, creates turmoil in vaccine policy and contributes to what Dr. Paul Offit describes as the weaponization of disinformation against public health. This isn't just about understanding genuine, albeit perhaps a misplaced concerns. It's about a well-funded, coordinated effort to spread falsehoods for profit and power, which directly undermines the public's ability to make informed health decisions.
Okay, look, I absolutely agree that disinformation is harmful, and the profit motive behind some of these figures is deeply troubling. There's no excusing the deliberate spread of falsehoods. However, I come at it from maybe a slightly different perspective. The success of figures like Robert Kennedy Jr. and, say, Del Bigtree isn't solely about their cunning. It's about their ability to exploit pre-existing anxieties and distrust, especially among vulnerable populations. They aren't creating these fears out of thin air. Many vaccine-hesitant individuals are, as Karen Ahrens notes, just looking for answers or they're unsure, and these figures skillfully tap into that uncertainty. Robert Kennedy Jr., for example, really appeals to that sense of being fierce protectors among mothers, leveraging their deep, understandable desire for control over their children's well-being. Yes, the anti-vaccine lobby has monetized the internet through advertising or selling fake nutritional supplements, and even fake autism cures. But this points to a significant underlying demand for alternative narratives, however misguided they may be. Nikki Hill Johnson, who used to be an anti-vax parent, even described getting a dopamine rush from sharing vaccine risks online. It illustrates the profound psychological reward and social affiliation individuals find in these communities. So, while the spreaders of misinformation are certainly culpable, their influence is magnified by these pre-existing vulnerabilities and, frankly, unmet psychological needs that public health efforts often fail to adequately address.
That's a compelling argument about the vulnerabilities that misinformation exploits. But it also leads me to, I think, a fundamental question. At what point does individual liberty, however well-intentioned or rooted in anxiety, become secondary to the collective good? Vaccination offers an inherently altruistic benefit. It's not just about protecting yourself, it creates herd immunity, that protective shield for the entire community, preventing widespread illness and safeguarding the most vulnerable among us. Infants too young for vaccines, the immunocompromised, the elderly. Dr. William Schaffner described Florida's decision to end school vaccine mandates as shameful, calling it a step towards the bad old days of preventable disease resurgence. He argues, quite persuasively I think, that states already mandate actions like car seat use for children's safety, recognizing a societal responsibility that clearly transcends pure parental choice in some areas. Karen Ernst, director of Voices for Vaccines, frames vaccination as part of the social contract, an unwritten agreement where individuals act to protect the community. The rise of preventable diseases directly threatens this social contract, demonstrating that individual liberty cannot always override this collective health imperative, especially when the consequences are so severe, even deadly.
I'm sorry, but I just don't buy that it's a simple case of individual selfishness versus collective good. And I think that framing kind of misses a critical point. Let me tell you why. The tension between the authority of the parent and the authority of the state, well, that has been a long-standing and deeply ingrained feature of American society. Mandates, especially concerning children, have always struck a nerve for parents. Remember that Harvard SSRS poll? 80% of those opposing childhood vaccine requirements cite parental choice as a major reason for their stance. For many, maybe most of these people, this issue is fundamentally about perceived individual liberty and control over their children's upbringing, not necessarily a flat-out rejection of the science itself. The medical freedom rhetoric, which, let's face it, often becomes highly politicized and tied to fears of government overreach, resonates incredibly deeply, particularly among conservative groups, as Peter Hotez has observed. So simply asserting the collective benefit, while scientifically sound, may not be enough to overcome these deeply held beliefs about individual rights and the perceived infringement on parental decision-making. Public health messaging needs to acknowledge this deeply ingrained cultural value and find ways to bridge that gap, rather than simply dismissing it as antisocial or merely misinformed.
Ultimately, the evidence, I believe, overwhelmingly demonstrates that vaccines are one of humanity's greatest public health achievements. They prevent millions of deaths and illnesses globally. While we acknowledge historical missteps, absolutely, our robust scientific and regulatory systems have evolved precisely to ensure safety and efficacy. The current resurgence of vaccine-preventable diseases fueled by widespread misinformation, and yes, the actions of influential figures like Robert Kennedy Jr., represents a grave threat to our collective well-being. Upholding the scientific consensus and reinforcing that social contract of vaccination is, I think, paramount to protecting the most vulnerable and maintaining a healthy society. We have to continue to counter disinformation with clear, evidence-based communication and ensure public health policies reflect the shared responsibility we truly have for one another.
And I would say it's undeniable that vaccines are critical tools for public health. The eradication of smallpox, the dramatic reduction in polio, these are monumental triumphs, no question. However, dismissing genuine concerns or historical grievances as mere anti-science risks alienating individuals whose trust is already clearly fragile. Effective public health strategies, I believe, must move beyond just a top-down mandate approach. They need to truly embrace empathetic listening, transparent communication about both risks and benefits, and a willingness to engage with the complex psychological and social factors that drive hesitancy. By understanding the roots of this distrust, from past medical errors, which were real, to the cynical exploitation of anxieties by misinformation profiteers, we can work towards rebuilding trust and fostering a societal dialogue that respects individual perspectives while still promoting the collective good. A more nuanced, perhaps more human-centered approach may ultimately yield far greater vaccine confidence in the long run.
Well, both of our perspectives today truly underscore the immense complexity of this issue, revealing that there is certainly much more to explore within this crucial material.